everyone, it's Dr. Ellie here, and I'm here with my pod. This is Dr. Locke and my good friend, Catherine. Do you mind if I call you Catherine? Because I probably will revert to that. Okay, cool. If y'all don't know me, I have my podcast, obviously, I Heal Kids, and I also have a practice in Asheville, North Carolina called Middle Path Integrative Pediatrics. So if you need a holistic pediatrician, ages 0 to 21, then come reach out to me. Also, if you need functional medicine, ages 2 to 102, definitely reach out to me for that as well. We'll be talking about what the heck is functional medicine in this pod as well. And I also did some other episodes on it, so I'll link that too. And today I want to introduce my friend, Dr. Locke. She is an amazing, friendly, I'm not kidding. She's like the epitome of friendly neighborhood doc. Like that is, if I could describe her, that would be exactly what I would say about her. She grew up in a really small Ohio town. Her mom's a chiropractor and really showed her like how you have that healing connection between doctor and patient. And this inspired her to pursue medicine at A.T. Still University, which if y'all don't know, it is the premier osteopathic school. Mine was number 2. I can't claim number 1. And she learned to balance conventional treatments with holistic approaches, including osteopathy, which we're going to talk about what that is, food as medicine, and energy healing, which I didn't know you did. So I'm excited to find out about that.
Oddly enough, I learned in my conventional med school.
That is, oh, wow. I didn't, definitely didn't learn about that when I was going to med school, let me tell you.
Our class was 170, and this class, 3 people took.
Wow. I would have been the 4th. I would have been like auditing the class. Yes.
You come in with your aura just shining.
I've been like, I'm here, ding, 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 yellow, yellow, yellow. And people have been like, okay, you need to bring that down. All the kapha people out there. For anyone who didn't see the Ayurvedic episode, we had to break it into clips, but there's still some good clips on that. But kapha people, I need you in my life. Okay. I also want to just say that when you were in residency, you basically just kind of realized like the limitations of healthcare. Which I did too, where we prioritize like insurance and pharmaceuticals over personal care. And I think that's one of the reasons why we both started our own practices. So despite all this, she does prescribe medication when necessary, and I do as well. And we both do conventional and holistic healing. I do functional. Dr. Locke does not do functional. We'll talk about that later. And this is all why she opened River Rock Clinic, which River Rock, you guys, is the cutest little office. Like you have to go there. It's super calm. There's cute plants. Like when you walk in, like she's my primary care doctor. It's the only office that I have gone to where my blood pressure is lower in the office than before I came. Not kidding. Like I've actually tested it. Like serious.
Did you actually?
Yes. Well, I'm a little nerdy. And then in your free time, you love to, you like those Ohio style shredded chicken sandwiches, hiking with your brother in Arizona. And I know that you also do tango and love to avoid getting your toes stepped on as well.
Or stepping on others, yes.
Or others, yes. So, for all those tango people out there in Asheville, you may see Dr. Locke in your class.
Mm-hmm.
So I'm going to dive right in. Dr. Locke.
Yes, ma'am.
As an osteopathic family physician, I know that your care is unique. Can you just kind of start by sharing like what drew you into this type of medicine and how it shapes your practice?
I think what initially drew me to medicine was a little bit of ego. I was 20-something years old and I wanted to save people, right? I wanted to save lives. I wanted to study so hard that whatever I was studying would save a life in the future. But as the years went on in training, which is for doctors a minimum of 11 years, I think I got humbled, seeing enough patients and seeing the healthcare system for how broken it is and it can't hold all of our suffering. It humbled me, and now I think I have a little bit more of a grounded approach to medicine. I'm not here to save anyone. No one can. A doctor has never prevented death. We never will. So working with patients rather than against their bodies is what I found to be the most rewarding.
Yeah, I agree. I think you texted me the other day about like how we're just seeing so much emotional and spiritual health disconnects. And I think that's super true. I know in my practice, even in the pediatric population, you might not expect it. But I see that a lot where kids are just not connected to their environment as much as maybe we used to be. We're not connected to each other as much as we used to be. And this isn't a trash on technology. I know there are times where it connects us, like right now, where we're using it. But also, if it's, if we're using it in place of meaningful in-person connection, we're not ever getting that. I think it's a problem. And I do think a lot of us do kind of miss that spiritual connection. I don't mean religion necessarily, although it can be, but I think there's some aspect of like awe or wonder or curiosity that we have started to sort of like crave. And I think it does cause, especially in the mental health realm, it can cause disease. And, you know, if y'all don't know, if you have mental health stuff, it can cause physical health stuff too. And it's all intertwined. So I don't know. That was a really long answer and super rambly, but I do agree with you that we're not always able to quote unquote cure everyone, although there are great treatments nowadays for a lot of things. Like I just saw Skid got cured. I was so excited. It's horrible immune deficiency, y'all. Um, but there's this other piece with like chronic health concerns that I think conventional medicine sometimes misses.
Yeah, I mean, I think with direct primary care, which is what both you and I do, where we don't do insurance and we actually get 45 minutes with our patients where we're not typing the whole time, that has been so helpful to actually get at the core source of what their disease is. Yes, say it's an ulcer, a stomach ulcer. Yes, it's physical. Yes, it's eating away at their stomach. That's real. But like what happened before that? What stressors in their life? What mental health, anxiety are they dealing with? What systemic structures, right? Racism, classism, all of that. What is upstream of that ulcer? And it really takes time, which is why direct primary care is so amazing. Like that 45 minutes, it takes time to get through all those rungs of the ladder to see what was really that first step and treat that rather than band-aid everything down the line.
Yeah, I totally agree. I feel like this is true, I think, for family medicine as well, though I'm not a family medicine doc, so you can probably tell me, but I know for sure in pediatrics, I would add to that family systems. The other day I had a patient's mom who was like, oh, this appointment's about my daughter, not about me. And I'm like, no, no, no. You cannot do holistic health without also considering the family unit and extended family and the chosen family too, because all of those things impact our health and our well-being.
Yes. And community is so important and not in a cliche way. Like it keeps us alive. We know that loneliness is 10 times more deadly than smoking cigarettes every single day.
I know it's
Loneliness
shocking.
is
It's
its
shocking.
mortality rate is astronomical. And so when we have families in our clinic, both you as a pediatrician as me and as a family doc, we have to treat the family or else what are we doing? Just prescribing pills and making pharmaceutical companies rich, but we're not treating the real thing here. We're missing it.
Yeah, 100%. I want to jump in, Catherine, I was just curious, like, what is your definition of, let's start with direct primary care, and then maybe we'll just move into like the difference between holistic, integrative, functional medicine. And then I'll kind of give you my take too, and we'll see if we can come up with something that makes sense. Because I have to be honest, sometimes I even struggle to
I do too.
explain because then I end up
I do
talking about
too.
biochemistry and who the heck has studied biochemistry except for me and you. And then we're lost. So it's like kind of like when I talk to my accountant and I'm like, I don't know what you're saying. But how would you define direct primary care to start with?
Direct primary care is you don't, insurance is not taken nor accepted. It's not needed or accepted. You pay your doctor. So they work for you. Direct primary care means you pay them directly, usually $100, $200 a month, and they get direct access to you in return. That means they can call you, email you, text you. It's not an emergency room, but it is that old school relationship. It's bringing back community, it's bringing back family where you can go in and actually have time to figure out what the upstream causes of your ulcer is. It's revolutionary. There's over 2,000 doctors in America who are doing it.
Yeah. I mean, I think doctors are definitely recognizing the benefit. I think sometimes it's a little bit hard to kind of explain it if you're not already in a medical system that you're not happy with. But like, okay, I'm going to give an example of like weird insurance stuff. Okay. If you go to your doctor and you say, I think I have, this is like super relevant to me because I have celiac disease, but like, you're like, I think I have celiac disease. Like, can you test for that? I'm like having all these symptoms, like the doctor has to put like all these like special codes in to the computer so the insurance company like reimburse this correctly. And you're just dealing with like all this rigmarole, and you have to like basically prove to the insurance company that you're ordering like the right thing and why, and you're writing all these things in the note and blah, blah, blah. And it just becomes like an argument between you and the insurance company. Like, I'll give you another example. I had a kiddo. This was back when I was doing more conventional medicine. This isn't a treatment I would do now, but necessarily, unless it was like an extreme case. But I had a baby that had reflux that at the time I was prescribing, what was it back in the day? Zantac. Now it's Pepsin. And I prescribed a liquid because it's a baby. And the insurance company would not pay for it. And they were like, our algorithm shows that you need to prescribe a pill. And I got on the phone and I'm like, this cannot be this much of a big deal. Like, surely just misunderstanding, right? No, I spent an hour and a half online on the phone, old school, like phone calls, begging them to approve a liquid for this baby, and they would not do it. And I was like, this baby is like not, you can't pill, it's not a cat, like you can't put a pill down the baby's throat. And it was just like unbelievable. And like some of that stuff, like it's gone. Like we don't fight with insurance companies. We're not being dictated by the insurance company on how we treat you. We can incorporate more holistic practices for those of us that do that. We have that longer length of appointment time. We're able to get to know you. We will remember your name. We will remember most likely
Face.
where you went on vacation. Yes.
Yeah. Yeah, I think with direct primary care, get a direct primary care physician. It doesn't have to be Dr. Ellie. It doesn't have to be, but just get one. If you want to move the needle with your health, you have to have time with your doctor. The only way you're going to get that is direct primary care. For example, I was seeing a patient and she was pregnant. She needed thyroid medication. Her insurance company, despite paying them $400 a month, would not cover her pregnancy thyroid medication and the version that she needed. So I, as a direct primary care, was like calling up the pharmacy company, got a representative to come here, got a sample for free for the patient, got it covered when they told me about use this random pharmacy in Maine. And you can't do that in a regular doctor. Like that patient just wouldn't get her medication. The baby wouldn't have gotten the medication in utero. If you want quality, if you want someone that's going to be your actual partner in health, not just say it on their brochures, you have to get direct primary care.
Yeah. Yeah, I think that's key, like advocating for your patient, actually knowing your patient, creating that actual relationship. Because I mean, we've all had that experience, right, where you sign up for a doctor and these are good doctors. They're just like in bad systems, you know?
Yes,
It's not their fault.
yes. And I
Yeah.
was going to say, I was a doctor. Like, I went into
Yeah.
med school because I wanted to help people, right? That's what every physician assistant, doctor, nurse practitioner says. We want to help people. But you get burned by these insurance companies by being in huge hospital systems where they tell you you have to see a million patients and you have to do what's called RVUs,
Oh,
meaning more
yeah.
patients, more procedures, more meds, more whatever, more colonoscopies ordered. We're happy you can get a raise.
Hmm.
That's the
Yeah.
priority when you work for these big companies, and that's your doctor's priority if they're not your direct primary care. An exaggeration, perhaps, but that's certainly a part of it. I mean, the system that we're in, it's not for people, so you have to find these weird avenues where you pay your doctor membership every month, but it works.
It works. It really works. Yeah, it's like when I talk to patients about breastfeeding for half an hour, which what could be more important than to establish health for those that can breastfeed or chest feed? And, in a regular practice, you don't get paid, you get paid zero for that, which I will tell you from having worked in other companies, they are not pleased when I talk for half an hour about breastfeeding, right? But what's key for that baby's health, But if I take out a splinter, which I have done, um, and I know this because I had a patient reach out to me. The going rate for taking out a splinter, $685. $685. I was like, what? Why is that even a thing? Like, oh, let me just grab that splinter for you. And of course, everyone's like, pleased. And it's like, it's terrible. Well, I want to move into, I think that was great. And hopefully, if y'all have more questions about direct primary care, like definitely reach out to us, Dr. Locke or myself. And let's jump into holistic, integrative, functional, because these are terms that people throw around like, I don't know, like we should all kind of know what they are, but they're very like distinct.
Yes.
So, how would you kind of define it?
Okay. Here we go. I tell every patient who's doing a meet and greet with me before they're a member, Where are you on the spectrum of health? On the left side, we have only herbs, pharmaceuticals are evil, vaccines are here to kill us and cause autism. Very natural, you're empowered with your health, you don't need a doc. That's one side of the spectrum. Other side of the spectrum is conventional medicine. Do a pill first before anything, because those have the most science and evidence behind it, because only pharmaceutical companies can afford those studies. And if that doesn't work, the next month do surgery and see 10 specialists. Integrative medicine integrates the two world. So yes, they might prescribe some meds, but they'll try to do food as medicine first, or work with your acupuncturist, or God forbid, even ask about your mental health. So integrative integrates those two sides of the extremes. Functional is its own thing. Functional is cutting edge studies. So say they did a study in a rat when you do IV vitamin C and that helps with, I don't know, long COVID, just giving hypotheticals out there. Then a functional practitioner, maybe doctor, maybe not, will say, okay, this is really cutting edge. It's kind of natural. Let's try it out. They often use a lot of blood work to find out your specific biochemistry. Usually it's only a certain population that can afford it. A typical functional medicine, like basic panel, is how much would you say?
Oof, it's expensive, y'all. So the most common tests that I order, two of them are around 300 and one's around 120. And that's with my discount that I give all my patients. So it is not cheap. It's not cheap.
Well, probably
Yeah.
because you're direct primary care, you found those prices. But usually when I send people for functional, it's 1 to 2 grand. And that's the base rate.
Yes. And I will say, I have chosen to keep my prices as low as I possibly can to do the level of work that I give. And I also pass all the discounts on. There are functional practitioners out there who upcharge. So they're actually making money off of the labs that they recommend,
The
which I
supplements that they give for those labs.
which I pass on all the discounts. So I'm not, if I'm recommending something to all, I actually think you need it. It's not because I'm raking in cash from these tests, but you do have to be aware because there are some people that run their practices that way.
So functional medicine is different, right? It doesn't really fit in the spectrum. It's kind of natural, but they'll also do stuff like low dose naltrexone, which is a pharmaceutical for inflammation. So it's kind of like outside of that spectrum. Don't get me wrong, functional medicine's amazing. It's cutting edge. It's just on the edge of what's scientifically shown. I'm not a functional person, so I haven't seen the science on a lot of stuff, but it's truly amazing. It's not for everybody. And if you want functional medicine, go to someone who's board certified, like yourself, Dr. Ellie, someone who's had medical training so can see the whole spectrum and put that functional medicine into context and really make functional medicine work for you and be as evidence-based as possible.
Yeah, I think this is like a key point. There are practitioners who do functional medicine that are not actually like DOs or MD doctors. So it's good to know like where are they coming from? Like, are they an acupuncturist? Or, and not saying that these are bad providers, I'm just saying it's a different perspective. So it's good to know like why you're seeing them or why you're doing a specific test with them. I kind of explain it to people like this. It's a body systems approach where we're looking at the interaction between the neuroendocrine system, which for y'all that aren't doctors, basically means brains and hormones, with your gut, with your detox pathways in your liver. So that's kind of like, you could probably throw in like immune function in there too. I think a lot of people would, but we're looking at all the interactions of that in the body. And we're optimizing your health using dietary supplements. Now, this is a key point because a lot of people think herbs are dietary supplements. They are actually not. So, dietary supplements are things that you would normally get in food, but you just don't have enough of. So, you need more. Okay. If we see that on your testing. Herbs are a different category. Those are plant based interventions that maybe you would use without testing. You could maybe blend the both. Like in my world, sometimes I find myself doing that, right? Because I'm integrative, functional, all these things, but they're two different treatments. So functional medicine is using dietary supplements to optimize health by doing it through a body systems approach: brain, hormones, gut, immune, and liver detox. Okay. And the way that we look at those things is by doing certain kinds of tests. Usually in adults, I mean, depends on your situation, y'all, but That's why you need a consult. But usually it's going to be, what is your salivary cortisol level? Is that scientifically proven by a randomized, controlled, blinded study? No. And that is important for your functional medicine doctor to tell you. So this is not something that has all this conventional data behind it. However, I will say for certain conditions, I think it can be helpful. It's important to know what conditions it's helpful for and what it's not for. So salivary cortisol, looking at your gut pathogens, seeing what's going on in your gut microbiome, which that actually has some good evidence. Even in contemporary pediatrics, this latest issue, they're talking about gut brain, which I was so excited to see. I was like, ooh, we're catching on. So looking at inflammation. And then usually urine organic acids, which is how it's a way that we look at what your body's peeing out. So we know how basically you're processing food, how your brain is processing its neurotransmitters, which are hormones in the brain, how your mitochondria, which are the powerhouses that produce energy in the body, are working, looks at yeast in the gut, and missing one, detox pathways. So those are like the big three. And then maybe you want to do hormones, so like plus minus female hormones, like especially if you're perimenopausal or if it's a teenager that's having a lot of symptoms, although sometimes depends on, how far along they are in the cycle and what else is going on. So you might want to do some conventional stuff for that as well. But essentially, it's complicated and it's really good for, in my opinion, people that are fatigued, people that are burned out, people that have long COVID, female hormone problems, male hormone problems, non-binary people problems with hormones. Let me think, what else? Weight gain to an extent, but I think there's a lot of things. There's so much for weight gain that we can do that's not just functional. And then in kids, I would say the biggest things that I see are gut health, ADHD, anxiety, depression, really good for that. Now, I will tell you what it's not good for. Because I think there's major confusion. Like, what is it not good for? And it's good for y'all longevity, vitality. So like if you want to try and like optimize your current health. Why do we do testing? I just want to throw that out there. I have seen people come in on like 64 supplements. First of all, y'all, if you're taking 64 supplements, we do not know what is working. And second of all, if you've had no testing, we do not know what is working or what your body really needs. And third of all, if your supplements have become permanent, that is a problem. We need to get you off so that you're on like a few maintenance pieces, but like you're not on 110 things, because that is a functional medicine thing that has gone terribly wrong if you're on it for more than, like a year or two, something like that. Depending on how sick you are. I think I got off track. I was going to say something important. What was it? Do you remember?
Get off supplements, functional, non-binary.
Who knows? Well, I went off on a diatribe like I normally do, little Vada moment, but that's fine. I think that sums up like the difference. Oh, I know what I was going to say. What is it not good for?
Yes.
Acute injury or acute illness. If you are in an emergent situation, so your child has fever of 106, they're having trouble breathing, they are vomiting everywhere, they have headache with that fever, some kind of thing where your kid looks super sick to you, that is not a good time for functional medicine. And I don't know what your opinion is, Catherine, but I would probably argue herbals and homeopathy as well. I think that is a really good time to actually use Western conventional medicine, is like, I am dying right now. Like, yes, save me. Any of that, I think, is generally a good time, at least to start the process of getting evaluated to determine, like, is this something emergent?
Yeah. I think of functional as a specialty. Look for someone who's board certified, actually knows what they're talking about. Physician or not, just make sure they know what they're talking about. If you want to optimize your health, if you want to get to the core source that other doctors just haven't been able to help you with, optimize your health. It does not replace primary care. If you still need stitches, if you need antibiotics because you just happen to be really sick because you've been exhausted and there's no core source of illness other than you're exhausted and overworked, it doesn't replace primary care. Both of them can work in tandem. I love functional medicine, chiropractors, health coaches, doctors. I go out of my way to collaborate with them for my patients. We'll even have a call where I, as the primary care doc, talk to the functional doc and the patient's presence, and we're all collaborating. That's an ideal world. If you can get your direct primary care doc to do that, you're golden.
Yeah, and actually, you know what? Now that we're saying the word primary care, the other day someone called me up and asked me what is primary care, and I never really thought about that until they asked me. I guess just because I've been in it for so long. If you had to describe, like, what is primary care?
Primary is you go to your primary person, your primary care physician. Secondary is you go to like an urgent care. Tertiary is you go to the hospital. So it's your go-to person. If you're sick, if you need to adjust your diet, if your cholesterol is high, if there's a collection of symptoms you just haven't had the time to finally talk to a doctor to, your primary point person, the person that helps you navigate this insane medical world, right? To
Yes.
get somewhat affordable labs, to get somewhat affordable meds, to get somewhat affordable x-rays, they're your primary contact. They're your advocate.
Yeah. So in our worlds, like pediatrician is a primary care. And for adults, family practice primary care could also be for some people, OBGYN will do it. Um, maybe internal medicine, there's a few doctors who do primary care. Yeah. But it's basically like if you need a checkup, like a well check for kids or a physical for adults, if you have coughs, colds, if you have symptoms that you need to get assessed, that's primary care. I think that, yeah, I think that's, yeah, I think that's a really good definition. I love that you broke it down into primary, tertiary. Yeah, primary, secondary, tertiary, because I
Yeah,
hadn't
someone
really,
fact check on me. I think I learned that in global health in undergrad.
you know what? Either way, I think it helps like simplify it. It's like, oh
Yeah.
yeah, that's what why it
That's
makes
all
sense.
that's all it is in American healthcare is find an advocate who will help you simplify this insane complex system.
Yeah. And if you're from Britain, I think it's the same as your GP. So if you are like from another country where they say GP, or if you say PCP, that's all the same thing. So
Yeah, I don't understand how people, I think it's getting more popular now, will just have like 7 specialists. Specialists, they don't talk to each other. No one has like a bird's eye view. No one's helping the person navigate it all, being their go-to. I don't know how people do it.
yeah, that's really, really hard because for those of you who don't know, like if you are seeing a specialist, typically they'll send notes to us and then we can also call them if we need to talk to them to like consult further or talk about your case more or about you, which in conventional medicine or in an insurance-based company, you have no time to do, so that will not happen. But in direct primary care, it can happen because we can actually like schedule in, oh, I need to call this specialist, put it on our calendar and take time to talk about you. So another aspect I think is to like the fact that you're paying us to actually be able to think about you and advocate for you and take the time for you, which doesn't happen in insurance based too.
Yeah. And it's
I want to, oh, go ahead.
I was going to say it's really helpful for certain populations that need a holistic perspective. People who are LGBTQ, transgendered people, they need someone to kind of advocate for them, right? Or else they're in this insane soup of American healthcare system that not only is hard to navigate, but for certain populations can be really damaging, traumatizing, and confusing.
Yes. Yes. You know what? I was going to ask you about this later, but let's just do it. Let's jump in. So I know that you have a really good approach to gender affirming care, which I know I've had to spend some time moving from California to North Carolina, kind of equating myself to the new political environment here and the new laws. But how do you balance kind of evidence based medicine and individualized care in this space?
I encourage people when they're looking for a doctor to not settle if they're LGBTQ or trans. A lot of people settle with a doctor who is queer tolerant. So they tolerate their queerness. They say, okay, what are your pronouns? Type, type, type. Okay, well, do you have sex, men, women, or both? Okay, well, you're at higher risk because you're a man who has sex with men for HIV. So let's get you on PrEP because that's a pretty risky thing. That's tolerating. That's doing the bare minimum.
Yeah.
What you want to find is queer embracing. So it's not seeing your queerness, whether that be your gender, sexuality, or sexual behaviors, as risky, something that needs to be managed, and instead embracing it. Talking about things like pleasure, consent, those things are important. Medications can decrease your libido, they can decrease your ability to have an orgasm with your partner. And queer embracing physicians, not they don't just see queerness as a risk, but like how can we actually have that be a strength to propel you on your health? Queerness is incredible, right? It makes some people see queerness as creativity, right? Queer is weird. That's what the definition of queer is, right? It's just taking a weird or different approach and being really creative with your healthcare. So find someone who's queer embracing.
Yeah, I agree. And I think it's also important to point out that a lot of doctors, like myself included, I had zero training on this. Like when I went to medical school, I don't even think there was like one day in pediatric residency where it was like, other than what you're referencing, which is like, well, pronouns actually, that didn't start. I wasn't even told about that. No one informed me, and I was just learning on my own. I think, like, from a corporate standpoint, was like 3 or 4 years ago that that came into medicine. But when I went to school, I had no, and I'm not, and I don't identify, I identify as cisgendered heterosexual. So I really didn't have a sense. And I also grew up in the Midwest where I just wasn't exposed. Like I wasn't, I had no, I just didn't know. And I was just kind of dumb. And then I have to be completely honest, when Ellen came out, I was like, oh, there's like other people. And I was like, I am so dumb. And I had to go and like get all this training on my own. And I'm blushing because I'm embarrassed to say that, but it's true. But like I didn't know. And so if your doctor doesn't know and they haven't like gone out there and talked to like, what I've tried to do is I called up, the gender center. I was in California, so most recently at UCSF, and had conversations with the doctors who do this work all the time. And I made myself read a bunch of books and I try my darndest to understand and
You're like
relate.
Dr. Ellie. Find a doc like her.
Thank you. And I have to say, I still find myself messing up and saying breastfeeding
Yeah,
instead of chest feeding
I screw
sometimes
up
and
all the
stuff.
time. I'm learning too. And people who are transgender who are my patients, I say, when I get their pronoun time, say, I'm sorry. And then we move on. But queer medicine is different. And I think if you are queer, you should find someone who's queer embracing because it's different. Like, for example, women who have sex with women are more likely to get bacterial vaginosis. It's an infection that is often overlooked from people who only know straight medicine. Transgender medicine, it takes a little bit of extra training. It's not hard medicine, but you there's some learning to it.
Yeah, yeah, agreed. And I know it's a controversial topic, y'all, and a lot of people have different opinions, but I think it's important for parents to be aware because there are a lot of kids now who feel very comfortable sharing about their identity. And if you have grown up at a different time or in a place where you weren't exposed, you might be surprised if your child does have an identity difference. And then you might not know quite how to react or like what to say. And you might not even have a negative reaction. You just might just be like surprised and like not sure how to support them. And just kind of learning about it and being open, I think, is really important in taking steps. Now, North Carolina does have some laws against treatment in children under 18, from what I understand. So, as far as hormones, I believe we have to go to Virginia. So, that's kind of a point to note.
That's my understanding too. And my patients who are transgender know it better than I ever will that gender's a spectrum and it's not like, oh, we need to get you on hormones to get you to the other side of the spectrum, right? From female to male.
Mhm,
And it's not always needing to be medicalized, right? If it's a
mhm.
spectrum, you don't necessarily need meds to get to one side. It can also be an internal journey, an emotional journey, a spiritual journey, physical journey that doesn't necessarily require you to be on pharmaceuticals. Now, if you want, absolutely. But we don't have to medicalize it. And I think my patients tell me that the best. I mean, some will be on some herbs, some will express their gender in other ways, some will want to be on meds, some not, some will want to be off for a and I don't totally understand it, to be honest. And maybe I never will because I'm cisgender. But just be open and you'll learn it all. If you just have an openness, you'll learn it all. You'll mess up. That's okay. But it's not that hard. Just have an openness.
Yeah. Yeah, that's a really good point. Like everyone has a different journey and different wants and different needs. And I think just having like the willingness to like ask and talk about it, we might be, interested or surprised to learn like what are the actual needs. And now that we're talking about it, I really feel like I need to get a gender physician on here, like a person that does this work all the time. Maybe I'll reach out to someone. Hey, UCSF, if you're there,
You're
I
listening.
need you on the pod. or whoever's doing the work in Virginia. Maybe we'll do more of a session on that. I want to swing back though to another topic that we said we were going to talk about and didn't. And I think it's so important because I often struggle to describe this to my patients. This is another reason I wanted to have you on the pod because I know we have a lot of overlap in how we practice. Osteopathic manipulative treatment. If I say those words out loud and you don't know, if you know, you know. Like if you've been to an OMT doctor, you've been to a DO and you've gotten this kind of treatment, you know what it is. If you have never been exposed, you're like, is that some kind of like weird, like, what is that exactly? Is that a bone doctor? Oh, I don't know. So how do you describe that to your patient?
Osteopathic manual therapy, OMT, is done by an osteopathic physician. We get 7 years of training in it. What it looks like for you, before we can even go out on our own and do it, what it looks like for you is you lay down on like a massage table or something like a chiropractic table. And instead of us giving meds for your conditions, back pain, neck pain, IBS, fibromyalgia, instead of us giving you meds, we actually put our hands on you and we do healing. Now, we are trained to do the cracking like chiropractors. I can crack a neck, I can crack a back, I can crack a toe. But more often than not, you'll see the DOs who do OMT try to work with the body. So if my shoulder, let's say here, you can see it if you watch a visual version of this podcast. Say just on a micro level, it's kind of internally rotated. Working against your body would be like, let's get that back to where it should be.
Mm-hmm.
So we'll crack it back into place. We'll hear a pop and we'll feel really good in our ego. But a
Yes.
DO will say, well, why is your arm going that way? Let me support it here. Oh, okay, it's because your pec is really tight. Let's hold that here. Your muscle's clearly trying to internally rotate. Okay, now that we've waited 60 seconds, the Golgi bodies, or whatever they're called, um,
Yes.
the muscle, whatever,
Medical school.
cool things, finally relaxes, allowing that to release. And I don't have to crack the bone to get it back. I worked
Feels
with
so
the
good.
muscle and what it was trying to do the whole time, which was to protect you. So you'll see maybe a practitioner has their hands under things, making subtle adjustments and working with your body.
I love that interpretation because that's actually how I work with newborns because I'm certainly not cracking any newborn backs.
Any heads?
Oh my gosh. If you ever see that or someone says they're going to do that, just like walk away. That is not appropriate. Yes, but I do a lot of subtle work with fingertips and moving fascia. For y'all that don't know, it's basically the saran wrap that covers your muscles and kind of makes everything squidgy and yucky and knotty and stuff like that. It's like the first layer that will do that. And then underneath is the muscle. So I do a lot of fingertip work where I'm moving just tissue to kind of loosen things up because really, being in the womb for almost 10 months, 9 and 40 weeks, I mean, you're going to have some stuff. You're going to have some, positioning things. And then the birth too, right? Coming out of a vaginal canal, there's some stuff that can happen. Like you can imagine, like if you yourself was squished up into a ball for almost 10 months and then you had
Squish.
to push yourself out. I mean, yeah, like I'm thinking about my head and my neck. I'm like, oh my gosh, thank goodness they have fontanelles, which are the soft spots. But sometimes babies are born with stuff like little restrictions where their neck is kind of tilted one way, which is called torticollis, or they've got an arm that's kind of like, it's nothing like medical in the sense of like, oh my gosh, we need like a cast or something, but you can just kind of feel like the muscles and the fascia, and we just need to loosen everything up in the paraspinal and the thoracics and the arms and the legs. And so I do a lot of that work. And then also in older kids who, we all have ergonomic and kids do too. So we're all on the computer. If you're watching this on YouTube, you can see me. I'm like crunched up like a pterodactyl or what is it? Tyrannosaurus, not a pterodactyl.
One of the
Yes. Sorry, dinosaur doctors. I got that wrong. And children under 6. Um, yes. Anyway, so it just causes like all this pain, and kids are coming in with what they think are migraine headaches, and it's actually all these ergonomic problems. And do you need a migraine doctor? Probably not for that, unless there's some other factors going on. You need an OMT that can do this kind of work and also talk about the positioning in your environment, which is something else we do as DOs. Is like, what is your environment like? Okay. And in my world, toxins comes to play into that too. And I know in your world with holistic, avoiding toxins comes into play. How do you, so like in your world, because your world's a little bit different with the age groups that you see, how do you incorporate OMT into like routine care? And like what conditions like do you find it's most impactful for?
OMT is really good at treating musculoskeletal stuff, right? So if your arm hurts, elbow hurts, neck, back hurts, it can work with your body to make that better. It can work alongside some herbs or some medications. What I love to treat it with is conditions in your body, actually. So, like acid reflux, IBS, chronic constipation, chest pain, where your doctors ruled out any cardiac issues and it's just your joints and ribs.
Mhm.
It's really good for those.
Yeah. And I think too, in my world, I think for your world too, I don't know why I'm saying my world, but I think in our world, anxiety, I think it's
Yeah.
super calming, especially for the parasympathetic system and also for the parent child dyad. So, I think bring your infant to me, go yourself to Dr. Locke and get treated because energetically, if your child is okay, here's what happens. This is what I think. The first 2 weeks that a baby is born, I'm going to extend that to 4 weeks. The first 4 weeks, it is absolutely exhausting. It's exhausting beyond that. But those first 4 weeks, especially if you're the birthing parent, it's like you're healing, you're tired, you're sore, you're stressed, and your baby feels that. And the baby has big feelings as babies do. And it can be fussy, they can be spitty, they can be uncomfortable because they were just born and they need body work, all of these things. And their sympathetics can be in some babies ramped up. So now you've got a baby, and sympathetic, by the way, for all of you who don't know, that basically means they're running on like adrenaline. Okay. So they're ramped up. What does that do to you? It ramps you up. Well, now everything's like in a cycle where they're feeling you, you're feeling them, and you're just like, I can't calm them down. There's like nothing I can do, right? And that is a totally normal and understandable response. And y'all, it doesn't have to be that way. Like we can find ways to regulate ourselves in those circumstances. And this is, I'm not a parent. This is just from all the years of practice, just having done this work for 17 years and seeing this energetic connection. There's something there with the parent child dyad that needs to be, in my opinion, it would be so helpful to get addressed early on because it's just added support for healing. And you can speak more to that, Dr. Locke, like healing after OMT and healing after pregnancy. I know there's a lot that you can do with that. I don't specialize in that, but I think that it really helps the parent, the birthing parent, and then in turn that will help baby calm. And then overall the relationship as it's developing, I think, sometimes we can create a dynamic that is de-escalated rather than escalated. Now, that being said, as long as there's not like a medical problem that we need to address.
You know, what'd be really fun is if you treated the baby and I treated the birthing parent
Yes, yes,
together on the table. That would be really
yes.
fun. We could do craniosacral. That would
I
really
would
be
love to do that. I would absolutely die to do that. We should put together a workshop. If anyone wants that workshop or wants us to do an event like that in Asheville or around Asheville, like let us know. Okay.
yeah. And someone say yes so that it gives them an excuse to try it.
Yes, I might just do it anyway.
Yes, but perinatally, the birthing mother, birthing person's see, I get it wrong. I get pronouns and wordings wrong, and we just work
It's
through it.
hard. It's
The
hard. Yeah.
birthing person, their body changes. They have relaxin, which is a hormone released in their body that relaxes all the soft tissues so you could push the baby out instead of pushing it through hard bones that are clenched down. So the prenatal body, the birthing person is really loose where they shouldn't be. And then it causes a lot of pain. And then you get ligament pain, ligaments inside of you getting pushed out because of this bellowing belly, and that puts a strain on where your mid back and low back connect. So that thoracic lumbar connection, and youch, that's where you get back pain, even though the baby's in your belly. So that's really good to work when you are pregnant with OMT, but also when you're recovering, when you're often experiencing accidentally peeing yourself, when you're super stressed, when your nervous system is shot, and when your body's getting back from that too relaxed state back to like your structured self.
Yes, and I see that in the baby too. So, just so y'all know, there's a lot of clicking and popping and all kinds of things that babies can have. And a lot of times it's because of that relaxin, and it's not necessarily that there is anything horribly wrong. That being said, you do want someone to check, especially those hips. Okay. But sometimes it's just something we need to just deal with OMT, with osteopathic. Well, I have, because I just love you and I could talk to you like literally all day. I have kept you forever. I'm looking at the time now. But for listeners who like just are inspired by your perspective and they want to learn more about your practice and they want to connect with you, the always eloquent, always professional, always super nice and calm Catherine Locke, where can they find you?
You can schedule a complimentary meet and greet before signing up and giving me any money. That way we can both see if it's a good fit, right? If I'm a type of person that you could create a trusting relationship with. These are the populations I'd like to see more. I want to see sick adults that really have some medical condition that I can help with because I am a physician. People who have a lot of specialists that we need to make sure one specialist meds aren't interacting with another. Complex medical situations, liver disease and heart disease. I'd love to see more of that.
Okay, perfect. And where is River Rock Clinic?
Right by the Stony Knob Cafe, the famous delicious local cafe on the border of Weaverville and Asheville.
Okay, and tell us your website. Is it just riverrock.com or riverrock?
Nick.com.
riverrockclinic.com. So y'all go to there and book your meet and greet. And if y'all need a holistic pediatrician or you need functional medicine, then go to Middle Path Integrative Pediatrics.com. I'm so sorry for the long name, and sign up for your meet and greet there too. And I am wishing you guys well. Bye.